I have decided to come forward also to stop Dr. Harlamert. We want a part in exposing what he's been doing to us and to countless other patients and families. We understand that suffering, and we want to help see that stop. It needs shut down.
For the last 16 years, David Cutshaw and I, Barry Ruth, and our law firms, CohenMalad and Theodorson Ruth, have been working to put bad doctors out of business.
We were representing John Pflum. He had 48 stents, most of which were placed by Dr. Harlamert.
Normally, if a patient needs a stent put in their heart, they may get 1 or 2 or maybe 3. It's insane to think that a doctor put 48 stents in one heart.
We're also looking at another case where Dr. Harlamert sent the patient for a stress test, which was normal. But when he did the cardiac cath, he said in his procedure note that the stress test was positive for cardiac problems and at high risk for cardiac problems.
So we're investigating Dr. Harlamert's patients to find out how many others are there just like John.
Well, I've had 60 heart caths over the years, and I have 48 stents as a result. I went to the hospital very frequently. For 2 years, I was there about every 6 weeks on average for 2 years. It was incredibly stressful because I would have, of course, chest pain leading up to that event, and over time it just wore on me emotionally in a significant way.
I remember at least a couple of incidents where he begged me, Susan, please don't take me. Don't make me do that again. Please don't do this. And I would have to get him there because that's what we had to do. But it was very grueling watching him suffer emotionally. I wondered every time if this was going to be the last time that I would see him. Was this going to be the last day of his life?
Dr. Harlamert was somebody that I had really trusted, felt like he was a friend, that he was looking out for my best interest all the time. To find out that he really risked my life.
Here's a man who groomed us for years to enable him to do this to us. We believed him, and he just deceived us.
Doctor, it's my understanding after you looked at these films of Dr. Harlamert treating this patient in the operating room, the cath lab, that you found that 14 stents that he placed, Dr. Harlamert placed, were not necessary. Is that correct?
Yes.
Okay, doctor, you're going to show us an example of an area that he stented where there's no blockage. And it is true, is it not, that that circled area is a coronary artery that shows no blockage or stenosis, correct?
Yes.
This is a picture of him putting a stent in that same area as before where there was no blockage, correct?
Yes.
So this is one of the 14 instances where you found that he did unnecessary stenting, correct?
Yes.
I am convinced that I'm not the only one that this has happened to, or possibly in the future someone could go through this. And pain to my family, pain to myself, the dangers of someone receiving a stent that's unnecessary. I mean, that just has to stop.
I am angry about the other physicians in the practice who had to know. I'm upset with the healthcare workers. Obviously, they all knew.
It's baffling in a way that so many were aware. Why wouldn't you just step forward and do what's right.
Unfortunately, John Pflum is not the only patient who suffered at the hands of Dr. Harlamert. We've heard of patients having 70 or more stents put in their heart by Dr. Harlamert.
The only way to stop this, to prevent him from harming other patients, is to bring more litigation, have patients contact us so that we can investigate whether or not he placed unnecessary stents in their coronary arteries.
If you think you've been a victim of Dr. Harlamert, call us. We'll get your medical records, we'll get all the documentation, and have it looked at by an expert cardiologist to determine whether any or all of what had happened to you was unnecessary.